Hi, this is Dr. Tom Rogers at Performance Medicine, the Common Sense MD. I have another common sense type of fellow here with me today, Andy, my partner. He also has common sense. I guess it runs in the family, right?
I would hope so. Is this not kind of like looking into a mirror,
Kinda is.
seeing what you once were?
Yeah,
Am I right?
about 50 years ago. It's great to have you today, Andy. I
50
rarely
years
get to talk with you in my podcast or anything, but I just sent Andy down to Hollywood, Florida. He actually used to live in Hollywood, California, but this time it was Hollywood, Florida, for the spring meeting, the A4M, that I got my board certification through American Academy of Anti-Aging. So actually, I'll tell you a little story about how I got involved with them. Probably 18 years ago, I was a regular family doctor, and I got some CME time. I had a week off that I had to take a particular week. And at the time, I was working in a large group, and I needed to take that week for some CME. And I wanted to go to Las Vegas just mainly to have fun. So the only thing I could find in Las Vegas that week was an A4M conference. So that's the only reason I signed up. And I signed up fully meaning to sign into the first lecture and then leave and have fun on the strip and, do all the fun stuff, gambling,
Like any
shows,
good
all that.
physician would do. Exactly.
Right. So I attended the first lecture, and literally a light bulb goes off on that first lecture, and I thought, this is really where I need to be. I need to hear this because I've been practicing medicine the entire wrong way, or at least what I figured was the wrong way, because they were emphasizing things I'd never heard of, like what is the cause of that inflammatory bowel disease, or that why is that patient a type 2 diabetic? And so they started talking about food and hormones and nutrition and vitamins and getting to the root cause of the problem through various testing and different modalities that I could use in my practice that would actually help a patient. Because before then, literally, as family docs, we're sitting there on a computer writing down your symptoms and trying, have about 7 minutes to spend with a patient because we have to run a lot of patients through there. And we're literally searching for codes to assign to that disease. Then we're prescribing a bunch of medicines. And there you go. I'll see you back in 3 months. We'll treat your blood pressure, your high cholesterol, your diabetes. Here's what you need to see in 3 months. Without literally asking somebody what they were eating and how they were sleeping, what kind of lifestyle they had. And not doing the advanced testing that we've learned to do. So ended up I stayed for every lecture, and that light bulb stayed turned on. It's still turned on. Ended up spending a lot of time and money doing that fellowship, and then going to Boston for my orals and the writtens down in Miami. I mean, it was a lot of hard work, probably more harder work than I've put in my entire career. And that's been about 18 years ago. And since then, I've changed the way I practice, came back and thought, I have to hang my own shingle out because there's no way I can practice like this in a large group. So I went on my own, named it Performance Medicine because I wanted your body to perform at its best. And so anyway, it changed my life and the way I looked at my own aging and the way I treated my patients. And I know I'm a much better doctor, and I try to get to the root of the problem, and sometimes it's hard. We do a lot of things with gut health and hormones as you enter andropause or menopause, or in your case, puberty. And so I love the joke. My kids never get my jokes. But anyway, you went to this. The whole reason I'm spilling this is because you went down to your first A4M conference.
I did.
And tell me what you learned, what you really thought about it compared to some of the other medical conferences you've been to.
Well, I have to say, too, I was around 18 years ago when you made this transition, and I'd just like to tell everybody out there that you haven't aged a day since. You haven't. In fact, I feel like we are going backwards. I don't know if you've heard of the curious case of Benjamin Button. You might have that disorder where you're aging backwards. Yeah. Yeah, well, maybe not that version of it, the book version of it. But, we're just trying to make it back to when we're babies. Just nice baby-like faces. No, it was a great conference. I honestly, because a lot of what we do in the office, we go based off of our supervising physician's experience. That's what PAs kind of do in every field. I was just with a bunch of my PA friends. One of them got married. Congratulations, Hallie and Tucker. And two, we all kind of have siphoned into psychiatry, into orthopedics, into urgent care. And we go a lot based. I was talking with one of my great PA friends that works in orthopedics, and she is kind of tailored her practice to what her supervising physician does. So if he goes like this with his elbow in the OR, she has to do certain maneuvers for him. So in our field too, in integrative health, we go off based off what your experience looks like. It was really nice to see it in person. I think every practicing, whether you're a physician or a PA, MP that likes integrative health needs to go to this conference, because you're around a lot of like-minded people. We don't sound as left field, because sometimes when you get in our community, we sound left field and non-traditional, and everybody there is on the same page, which is cool. Everybody there also is probably 105 years old, and they look like they're 20. I swear, you'll see someone that's giving a lecture, and you're like, whatever. I want to look like them. I think that's important too, that if you do not practice what you preach, it should go nowhere. How many times have you been to a provider that they tell you to lose weight and you're like, is that what you're telling me to do? I have seen that happen time and time again. And that is not what you see at A4M. And I loved it. This round is all about nutrition. It's the 30th anniversary. I don't know if you knew that, but it's 30 years.
Okay.
30 years of A4M, and so this is all about what you eat. So
You talk a lot about gut health.
a lot of it was gut health, but most of it is what you put into the gut. So there were lectures, and there's so many lectures there that you can't go to. So if you go as a team so that you can split up and conquer and divide and give notes. So I kind of cherry picked some stuff. I went to all the general sessions, but the nutrition was fascinating. It was really fascinating. And I do think a lot of what we put into our systems will dictate everything else. If you look at it more metaphorically, there's one, she was a PhD in nutrition and psychiatry, or psychology and nutrition, and she said, if you look at the food you eat, it's you are what you eat, right? So her big thing was eat the rainbow. If you don't have an idea of what you need to eat, she said, eat the rainbow. You should have a colorful plate, which my grandmother, who was just here, she always had a colorful plate, and your mom said that too. She said, if the food is charred and bland and brown and ugly, she said, that's what's going on the inside. She said, there is science too. It's all based in studies too about different colors benefiting different systems, like purple and blue is for brain health. It's in restoring neurons. It's really cool.
Being a type 1 diabetic, you could relate to nutrition because most of your whole life's been spent kind of looking at what you eat, counting carbs, basing your insulin intake, your shots on that amount of carbs, how much exercise you're going to do. So it's a tough life that you and Kelly have both experienced, but you've both done well with it, stayed lean and active. Actually, you're probably, for your ages, you're probably some of the healthiest people I've seen at that age. So it forces you to really act. I mean, you have to set an example, and you really have, and you're a great example for your patients as well. I think a guy like you is more able to relate to somebody with diabetes than me. So I sure appreciate that aspect that you bring, that you're an expert in diabetes. Give us some other pearls for what you learned down there.
So most of it was about nutrition. So just blanket bullet points about nutrition. Everyone had a different opinion. Every single one presenter was on for keto, one was on for all plant-based, one was on for vegan, one was on for this. They all consistently said that the only diet plan, if you're going to go on nutrition, the only one to prove longevity is Mediterranean. They said that's clinical, and they see it in practice. They also said too, we actually had a guy that was from Salerno, Italy.
Really?
That's like, he said that was actually what poor people ate. He's like, you think it's some expensive diet? He said that's what people could afford to eat was Mediterranean. So it's really, most people think that healthy foods are more expensive, but Mediterranean is not. So that was
interesting.
They all said more plants. Every single one of them, less meat, more plants.
Yep. I think I'd agree with that. Everybody's different too. And it all starts in your gut. There's a lot of people that can't tolerate meats. I mean, that's one reason we do the TMAO test on the Cleveland panel.
Exactly.
There's some people that half of us can't tolerate dairy. Half of us can't tolerate gluten. It's probably more. But I was telling a story in one of my podcasts the other week that this fascinating case. I had a patient that had been, and a lady that was probably in her 60s, just recently diagnosed with ulcerative colitis.
Oh, yeah.
And a very serious disease. And so when I started interacting with her, the GI doc immediately wanted to put her on Humira and maybe methotrexate, or some heavy hitters that she didn't want to go on, because not only do they have a lot of side effects, they cost a lot of money. Thousands of dollars a month if you go on Humira.
Yeah.
So I asked her if the GI doc had ever asked her about her diet at all. No, he never asked me anything about what I ate. And to me, that's just terrible medicine.
Yep.
You can't diagnose somebody with a gut problem and not ask what they're eating.
Right.
Because that can change the whole game,
Yeah.
in my opinion.
It affects your mood too. They said 85% of your serotonin is made in the gut. So there's a lot of anxiety, depression that comes with food. And you think about sometimes the comfort foods, and they call them comfort foods for a reason, because they spike dopamine and hit a pleasure receptor in your brain to make you immediately feel better, but then immediately feel worse afterwards. But if you don't protect your gut and you don't support your gut and eat well, that serotonin, you don't use any of it. 85%, I did not know that, is made in your gut.
Yeah.
And there's even, they say brain to gut, there's also gut to brain access to it. Works as a two-way street. There were a ton of other things. It wasn't just nutrition. Another big thing, which we're doing another podcast on, is nitric oxide. That was big for, we think of healthily aging. Whenever we do a panel called the Cleveland Heart, I always tell patients first that what happens in the heart is happening elsewhere. So why we get CT calciums, to see what the plaque structure looks like in the arteries surrounding the heart. You have to have endothelial health. So that's the lining of the artery. If that's not pliable, if it can't vasodilate or constrict, that's a sign of aging. It's a sign of inflammaging, is what they said, which I'm sure is a big AFib term.
That famous doctor, I talk about this in my podcast this week. Nitric oxide is the subject of my podcast because it rekindled some interest I've had in that many years ago. As a matter of fact, I think I've podcasted on it before, but as that great physician, I think it was Dr. Thomas Sydenham from England, 300 years ago said, a man is as old as his arteries.
Yep.
And that goes for every aspect of your health, not just your heart, but your brain, your liver, your kidneys. So I like that statement a lot. So
Yeah.
a lot of what we do is fighting inflammation, which is a culprit in almost any disease that we see out there.
And also, too, a culprit within I do compare a lot of what patients and what I experience personally is we're in a data-centric, information-centric, very stressful society. The modern age right now, we're meant to think as fast as our bodies can move as species. So we're not meant to ingest information. When I drove 85 miles per hour back from Atlanta today, I'm not meant as a human being with my brain to input and take that data in that fast. So it's no wonder we're immediately coming into the world with beeps and sounds and technology that we're not meant to have as human beings. It's a biological look. So we kind of have to tailor ourselves to this modern world. Stress is there. There's a great, Dr. Gupta has a documentary on low dose stress, like they call it a low burner stress for most middle class Americans. And it's low stress. And there's data too about being in middle class. It's that the stress of whether you're going to go down or up actually it's a more stressful spot to be in than the lower class or the higher class. I don't know. I think it's interesting. It's all to say that stress is big and sometimes unavoidable. So you got to kind of manage your lifestyle too. There was a guy named Ravi Shankar. I forgot.
Ravi Shankar?
Okay, Ravi Shankar came. Yeah, he came from India.
Really?
Yeah. Did I not tell you that?
He's a famous guitarist, isn't he?
No, this guy was like he was a spiritual. Yeah, I'm butchering.
He's
this.
probably a yogi because I remember
he
the
has
Beatles.
A practice.
That's
yeah,
interesting.
he's been around since then. Yeah, he's met every famous person you could think
wow,
of.
If he's still living, that's amazing.
He came and he talked about breath And he said
Wow.
that the study of breath, and he has a particular practice that I'll try to share that information. We'll get Sound Booth, if you can just make a mental note for that, and I'll get more information. Because
Sound Booth.
he came and spoke to us.
I would
and
love
they
to
do
hear him.
breathing stuff, and he talks about not being in nature enough and not being kind to other people enough, and that gives way more back to you and actually helps you out more. There's some places, this is off topic, but in England there's one clinic that will not put you on an SSRI. These are common drugs for anxiety, Zoloft, Paxil, Prozac. They will not put you on one of those unless for a month you have demonstrated that you have exercised, eaten well, and done something for your community.
That's a great thing. You know, there was a study
1 month.
that came out of the American Medical Association 2 weeks ago, a huge study that said that antidepressants flat out don't work. And I believe it.
That's interesting.
Not only do they cause a lot of side effects, they just don't work.
But why do I feel so good right now? I'm kidding.
I hope he's not on one.
Something's working, right? So, but there was other stuff too. So we had a lot about, I felt like a lot of it was not, I don't want to say like traditional medicine based, like prescribe this medication. Like there wasn't, I didn't go to a lecture on metformin, but or the GLP-1s, which I love so much, like Ozempic. But a lot of it was on nutrition, on breath. Then they also had nitric oxide and some of the naturals that everybody should be on. There's one on glutathione.
The master antioxidant.
Exactly, and that gets depleted so often too. It gets depleted every time you drink alcohol. Glutathione goes down, and those are your protections. So too.
I told you when you were a kid, alcohol was not good for you.
Uh,
He didn't listen to me.
I know. Yeah, all those times I was just having fun in the basement. Am I right? But we're back in the basement now. It's come full circle. Anyways, no. Glutathione was one, and there was a product called Glutaril. The problem with glutathione is actually getting it absorbed. So they say that by mouth glutathione has a very short duration of action. IV glutathione pushes, which some clinics still do.
I used to do that.
They only last 14 minutes.
Yeah,
that
I
is
know.
as long
We
as
quit
it
doing
lasts.
them a couple years ago because they were kind of more expense to the patient, and it just didn't work. To
14
be honest
minutes.
with you,
And can really bottom out your
So
blood
we never,
sugar, too.
when we're giving a Myers cocktail or vitamin C, we never put glutathione in it anymore. But there is a way that you can get it in.
There's now skin.
Yeah,
it's it's
your skin.
transdermal. It's Glutaril. Is this company by
I
Aura
can't
Wellness.
wait to try that.
I got it.
Did you?
I ordered it. I'll let you
Oh,
know
wow.
if I end up becoming beautiful. You know what happens. So you can put Glutaril on. You can put it on anything. They did it. Yeah, they said for wrinkling, for anti-aging with skin health, but also to this guy. I talked to that guy too, Dr. Patel. I'm butchering all the names. I don't have them in front of me, but he said he puts people on very little supplements with this. He says that
That's
takes care of everything.
interesting.
But he also made the product too. So
That and maybe nitric oxide will be good to go.
nitric oxide. He was big on vitamin D. Everybody there, if they did say everybody, you have to take vitamin D. They said everybody. They said it's a no-brainer for
That's
anybody.
a no-brainer. I mean, we were
And-
preaching that during COVID, whatnot. We got
Oh,
out on
yeah.
the side of the interstate and held signs up, take vitamin D and avoid hospitalization. Probably the best piece of advice we ever gave anybody.
Another one too, low-dose naltrexone. There's
Love
Dr. Smith, which you've know Dr.
Pam
Smith.
Smith,
Pam
yeah.
Smith. So Pam Smith is an ER physician that has been with this A4M since its inception, I feel. She said every patient with autoimmune illness, every single one, she said there's 105 known autoimmune diseases. She is now including 106 as COVID long haulers secondary to the vaccine and actually having COVID. She said both. Every single one of them needs to be on low-dose naltrexone. Have we had a podcast on low-dose naltrexone?
We
Like
have.
an
We need,
in-depth-
we have. We need to do another one, though.
We'll do another one when we bring on.
I'm a huge believer in LDN. I try
Oh.
to put a lot of people on that, and some people don't understand it.
It is unreal the data she showed from that. I got some the next day. I have two autoimmune illnesses with type 1 diabetes and psoriasis
Yeah,
too,
you
which also too deals with the gut. Interesting fact, the doctor from Salerno that talked about nutrition said the first 1,000 days of your life sets the course for your immune system. He said he said first 1,000 days, 3 years, the things that you ingest, the things that happen to you, circumstantially, nutritionally, emotionally, psychosocially, all of it contributes to what your immune system looks
That's
like.
interesting.
The first
Isn't your
1,000 days.
personality form at that time, too?
I don't know, but I had a lot of orange soda. Am I right? So I guess that's what happened.
Well, you were a beautiful, you were a beautiful baby, but
I did win some Baby Beautiful contests, but middle school, oof, yikes. It didn't really get better. It does get better, ladies and gentlemen. It does.
Well, here we have baby boomer, millennial.
Yep.
So, in our traditional practice, it's almost like we're not holistic, really. We're a blend between traditional, the great part of medical miracles, and what I call it, and alternatives. So we have open minds. We look at both. I want to use the best of traditional, the best of alternative, and hopefully get to the root of the problem, and maybe even listen to the patient occasionally, like every time.
Or you had told me, you said the patient, nine times out of 10, the patient is going to know exactly what's wrong with him and how to fix it. You just have to sit and listen. And that has been the case. That has 100% been the case.
Sometimes you have to get them to sort it out and untangle it for
Or
them.
two, even when you come in, if you come in with a book, it's gonna, and I don't want to say red flag, that sounds like that's a bad thing, but like narrowing it down to one piece as a patient. I do think we need to have a podcast on how to be a patient.
Oh, I think we've had them. Ben and I have done some
on
podcasts
how to
on
be like a that's good.
Yeah,
I listen to the podcast. I'm kidding. I listen to all of them
I don't think
religiously.
he listens to them.
To end it out though, they also had this big vendors, like all these. You've been to these, so they have this whole convention center full of vendors from all over the United States. And some of the cool stuff, I got to go in a hyperbaric oxygen chamber.
I'd love to have one of those.
The coolest thing ever. It does feel like you're literally going up in an airplane. They give you gum before going in to chew.
Ears pop, yeah.
Ears popped. I didn't feel different after that. You have to do it. They said technically you need to do it every day to really notice the benefits of anti-aging. That's like what
I've
Elon
heard 2-3
Musk.
times a week.
This is just what this company told me is every day.
Does Elon get in there? Does Elon get in there?
He wasn't in my particular chamber, but I'm sure he does. I think he has his own. A lot of the Real Housewives have him too. Then I got in a red light therapy. Looked like a tanning bed, but it wasn't tan. A red light therapy bed, so it totally encloses you. It's supposed to be great for your blood cells. I actually don't.
I mean, it's kind of like my infrared sauna has a red light in it too.
Yes, I did tell them about your sauna. They said that you need one of these too. Of course they did. But yes, I got one of those, which was really cool. They had a float, like a chair.
Floating tank?
It's not a floating tank, but it was a chair that you completely get sound and sight out, and you're floating. It's almost like zero gravity chair. It makes it feel like you're flying, which is really cool.
I'd like to have one of those.
And then they had a ton of naturals and supplements, and the nitric oxide. You got to try that, which was cool.
So you learned a lot and came out of there knowing that we're practicing the right kind of medicine.
100%. It made me not even. I knew going in, well, too, because it's family business. So I've known that it's good. That came out reaffirming everything that I thought going into it. And two, like, we need more people practicing like this. We really do. It needs more access to more people. And people think it's like outside the insurance world and you have to pay like it all, I will tell you, all comes out in the wash, and you need to spend the most money on yourself. You do on your health.
In the long run, you're going to save a lot of money, time, effort. I see a lot of very wealthy patients, and every one of them would rather have their health than their money as they get older. Yeah. So,
and start early. An ounce of prevention worth a pound of cure.
We try to look 10, 20 years ahead of your life and see what's going to happen to you.
And I'm looking at him, all right? It's not that bad.
Disappointed? Sorry.
No, thank God. Right? Woo. Yikes. Hopefully the apple doesn't fall far from the tree. Am I right?
Hey, Andy, thank you for coming. Thanks for going to that conference. I mean, that's a lot of fun, but I thought you'd be down there partying the whole time. But actually, he called me and sent me notes and had a good summary.
I actually go to class. I'm a type A nerd.
I was proud of you. I was really proud of you.
Thanks. I liked going that. Anytime that you want to use the company credit card to send me to different places and take time off, I will gladly jump on board. I will not say no.
Okay.
Thank you, Performance Medicine. That's what we say a lot.
Okay, Andy, let's wrap it up. Thank you so much for being a part of our practice here.
Thanks.
You're the new generation. I hope you carry it forward well. We're all going to be around a long time, hopefully. So thanks. We'll see you next week.